Let's talk about ketamine dosing and the K-hole from a pre-hospital perspective. The lowest dose of ketamine that we would administer would be somewhere around 0.1 to 0.25 milligrams per kilogram, and that would be for analgesia, for pain. And your patient, besides feeling that analgesia, will feel some mild euphoria and sedation just like they would with fentanyl and morphine. Now I'm going to skip a step. I'm going to skip a dosing range and go up to 0.5 to 0.75 milligrams per kilogram. That would give us mild dissociation. We would like this dosage range for when we're performing a painful procedure, something like cardioversion. Those are the patients that are looking at you with that 1,000-mile stare. They're not talking with you, they're not interacting with you, they're not interacting with their environment, but they're not completely dissociated. In between that mild dissociation and the pain dose, that's the recreational dose. We really have no reason to give a patient that dosage because all they're really experiencing is being really high. Once we get over the 0.75 milligram per kilogram dosing, that's when we're starting to get into complete dissociation. Your patient is completely unconscious. And this is where it gets tricky when talking about the K-hole because that means different things to different people. For us in EMS, we tend to talk about the K-hole being that complete dissociative state where they're actually unconscious. For people that use ketamine recreationally, they think about the K-hole as being in that recreational state. The K-hole is actually everywhere in between that pain dose and complete dissociation. It's not your low analgesic dose, but it's not complete dissociation. The K-hole, simply put, is when your patient is experiencing that sense of unreality or being detached from reality. And starting with too high a pain dose or too low a dissociative dose can get your patient in the K-hole unintentionally.